world should get a nice private chat with Dr. Tanushree. So let me quickly introduce you. Today we are talking to Dr. Tanushree Pandey Padgaonkar. She's a gynecologist and an infertility expert. She also has a private practice in Mumbai. You can get in touch with her for online and offline consults. You can also reach out to her on Instagram. Her handle name is Gynae Guru, and she's done her DE from Germany. And the topic that we're going to talk today is, I think, very important for all our pregnant moms, right? Like a lot of times when we get pregnant, even like it doesn't matter if we're pregnant for the first time or the second time, because by the time we're pregnant for the second time, we've forgotten half the things, right? Like what our gynacs would have told us at that time. So today Tanush is going to take us through five very important questions that all pregnant moms need to ask their gynac. So let's quickly get started, Tanush.
Thank you, Barka. Thanks for such a lovely introduction. And yes, I think the topic that we've chosen today is a very apt and a very basic topic, but yet something that every pregnant woman, whether the first or the second time doesn't matter, wants to ask her doctor, and sometimes is not sure how to put it across as a question. So we'll just cover it into five broad terms and try and answer most of the questions.
Right.
So I think the first question that you should ask your doctor is, which maybe she's not able to tell you in the first time, but maybe in the couple of times that she meets you, is your personal risk index. So what do I mean by that is, see, no pregnancy is no risk, okay? Because it is a state wherein physiological changes happen, everything increases, like your heart rate, the blood flow, all of that. Some people, blood pressure may increase, sugars may vary, thyroid levels. So there's almost always some risk attached. So that we label it as low risk pregnancies. And then accordingly, your doctor will allow you, say, okay, fine, you can travel, you can have sex with your partner, you can exercise. So these are the low risks. Then there'll be moderate risk. So we quantify on the basis of age, we quantify on the basis of, sonography findings, cervical dilatation, infections, a lot of things that we gynecologists look into. And then, of course, there's high risk, the ones who have high blood pressure or are infertility conceived, through IVF cycles, or diabetes mellitus, and so on and so forth. Then they come under high risk, and then you have to follow everything that your doctor tells you to the T. So you just can't pick up your weights one day, or you just can't, book a travel plan and go, because maybe then those things are not exactly allowed. So I think risks stratification is very important. Important on the point of the view of the doctor also, because then we know when and how to call the patient. Some the regular patients we'll call, say, once in a month initially, but these patients maybe twice, once in 2 weeks, or once in a week, depending on that. And the patient also knows how to manage her pregnancy. So
Right.
I guess that will be point number one for me. Point number two, of course, will be, how much weight do you have to gain as per your BMI? So पहले there was a myth, that pregnancy है, चलो घी के लड्डू खिलाओ, or high calorie diet, and the patient has to look plump and nicely
Eat for
fed,
two.
eat for two. So I think that we all somewhere know is not true. So if I speak about an ideal BMI, which is between 18 to 22, there you have to gain about 11 to 16 kgs maximum. And depending on if you fall into a higher BMI category, the weight comes sometimes as minimum as 6 kgs, which is nothing. Which is, your baby and your amniotic fluid will cover for it. So basically, you don't have to gain any weight.
Anyway.
And then if you are like less than 18, then maybe we tell you to gain extra weight, and so on and so forth. So I think BMI again, and weight gain accordingly, so that you are also not felt burdened, because sometimes initially patients come to me, they're like, Madam, I've lost 1 kg in the first trimester. So most women lose weight in the first trimester, and it's
Yeah.
normal, because there's nausea and they have vomiting and all those, pregnancy initial blues. So
It,
it's
I
normal.
I had lost 7 kgs in the first time.
Imagine that. Now imagine that.
7 kgs in 3 months, and nobody could tell I was pregnant. That was the best feeling.
Exactly. And then you have those lovely relatives at home who start telling you ki, "Arey, तुम्हारा तो पेट नहीं दिख रहा," or you become anorexic, and then the anxiety takes a toll on you. So
Yes.
I guess that way, when you know that I have to gain 10, 11 kgs only, and 4, 5 kgs are gained in the second trimester, 4, 5 are gained in the third trimester without doing anything also.
Yeah.
So then you are at a relaxed way. Your doctor is not troubled. You are not troubled, as long as your blood values are right. So I think that will be my second point. Now, the third point is that we as doctors have started doing it already, but I think patients, because of Google, have become very inquisitive. Now, there's a good side to it and a bad side to it. So, maybe in your first or second visit, you can have a rough estimate from your gynac about what are the basic tests and sonographies or ultrasounds that are going to be done. Because certain protocols are standardized all over the country and they'll happen for every patient, right?
Oh,
Say, the first scan for fetal cardiac activity, then your NT scan, then your anomaly scan. Like, these are certain things that will happen. Your quadruple marker test, your first basic investigations when you visit your gynac for the first time. Then there are certain things which are repeated at 24 weeks, at 28 weeks. These are for a low risk pregnancy, which are standard. Like, I have a set protocol for all my antenatal patients. So that is one thing wherein then you also see, because these days pregnancy is becoming an expensive affair. Also, let's face facts.
yeah,
Everything is becoming
yeah,
expensive. Whether blood tests, whether hospital charges, whether, so you have to be mentally and financially prepared both. Then only will you enjoy your pregnancy.
true.
Otherwise, either you're mentally prepared or you're financially not prepared. Then you're perpetually stressed.
Right.
And plus, how frequently you have to visit your doctor.
Yes.
And I think the fourth point would be, Barka, something that we are all curious and we want to know, can I exercise in pregnancy?
Yeah.
Because some of us are fitness enthusiasts, the other ones, they don't want to complicate their pregnancies. And so you have to understand that I think after the first trimester, we generally tell the patients to take it easy. That's at
Okay.
least the mantra that I follow, because the fetus is weak at that time. It's taking its own due time to finish implantation. The placenta is taking its time to take over. So we tell them to go a little easy. And then after 12, 13 weeks, if it's a low risk pregnancy, then of course you can go back to the kind of exercising that you were used to earlier.
So that should include lifting weights and
Even if
running.
you, yeah, exactly. So if you are lifting weights already, don't start weightlifting in pregnancy, is what I say. Because
Yeah.
when you don't know how to do it, then you're learning the form. Then one day you'll have a back catch. One day, your neck will be in spasm. Arey Baba, you're already in too much, your body is going through enough changes. But if you're somebody who's weightlifting already, is used to a certain form of exercise already, your doctor has labeled you as low risk, has given you a thumbs up to exercise, you can go back to it. Then,
Right.
of course, always and always do it with a professional so that they know which exercises are
Yes.
allowed, which are not,
Yes.
right? Because we label them in a broad term as isotropic exercises. So there are certain exercises that are allowed in pregnancy, the others are best avoided unless and until you absolutely have to do it.
Right.
And then, of course, there are all these forms of exercises that are coming up these days, lamas and different forms. And then there's prenatal yoga.
Pregnancy yoga.
Yeah, and they are good. See, personally, I feel if they do nothing at all, they help you manage your stress, which is a huge factor, Barka.
Right.
Once the stress is managed, half of the things like your blood sugars and your blood pressure are controlled very well.
Also, you get to socialize. You get to meet other
Exactly.
pregnant moms. So it's
Absolutely.
just a happy feeling
Happy
more.
feeling, and you get to share your problems. That usko bhi hua. Then you get little relaxed.
Yeah.
Doctor will sit up and tell you very professionally, see, you're normal hai. You'll not feel like
Yeah.
that. But when five
Yeah.
other pregnant women tell you you're normal hai, you calm down. You're like, huh,
Yeah.
you're
Support.
normal. Yeah, yeah, support. And the fifth, of course, is I think we all want to know somewhere or the other, can I have a normal vaginal birth? Or is
Yes.
it going to be a cesarean section? So, see, it is very difficult, Barka, to label it 100% as normal
Correct.
vaginal birth, correct? Because there are so many factors that go in. It's like a beautiful mechanism that God has created, and it takes its own time to sort of function. And it only happens when it happens. Earlier, we used to, examine the pelvis and tell you whether it's adequate or not. All that has become obsolete. Latest WHO guidelines, what they say is, do not evaluate the pelvis till the patient is in active labor, meaning that the cervix is 4 to 5 centimeters dilated. But
Correct.
if the labor has already started, the pains have already started, the head I can already feel. That is when I should comment on the pelvis.
Right.
Because what happens is, so many times when the patient goes in labor, the pelvic muscle sort of and the bones realign a little bit and give little more space for the baby to come out. So
Right.
sometimes I may label a pelvis as inappropriate, but during labor it's a small baby and it will come out.
Right.
So even earlier we used to have very stringent rules about, if you're less than 5 feet, maybe we'll take you for an elective LSC.
Yes.
All that has changed because probably a 5 feet lady is going to give birth to a small baby which will come out. And
Yes.
at the same time, you might be a tall, very spacious, roomy pelvis, and there might be something very small that goes, the fetal heart drops. There's
Yeah.
meconium, basically the baby passes stool in the tummy, or the amniotic fluid reduces. And there are so many things, and you might land up in a C-section. In today's day and time, whether it's a normal delivery or a cesarean section, they are both equally safe for us, even as obstetricians. Our lookout for patients has changed a lot. Earlier, Barka, we all know we used to have 4 children, 5 children in one family.
Right.
Now we are all restricting to one, maximum two. So
Yeah.
birth and life has, I think, just become so much more precious because
Yes.
we are facing difficulties in conceiving, time constraints are
Yeah.
there, and then we have better scientific tools too. So
Right.
never ever feel that, this doctor only wants to do cesarean sections. I could
Yeah.
have had normal birth. Don't blame your doctor. Don't blame yourself, because both forms of birth are beautiful and you're going to enjoy and cherish it.
Yes.
So I think these are the five major points
Broad things.
I've
Yeah.
tried to cover up.
Like a lot of times, like I have friends and they're like, please conceive before 30,
Huh,
like at least have one baby before 30. So
huh.
what are your thoughts on that? Like what do you feel is like appropriate? Of course, everybody has a personal choice to make in life, but then what is
Right.
your thought on that?
See, as a gynac, strictly I'm speaking, not as a personal choice.
Yeah.
Is definitely there's no denying that we are all on a biological clock. It
Right.
takes, and you cannot fight that. Now they say that they say it's proven that fertility starts decreasing after 30, but the amount that it decreases is very less, say 10 to 15% reduction. 35 ke baad significant drop happens. So what I personally follow with my patients, with myself, I'm 31, I'm married, I'm not ready for children. I have no problem. So what I have done is I for myself, so that's why it's a
Yeah.
very personal thing that I'm talking about. Always check your ovarian reserve. Now, how do you check it? Is we do a scan on day 2 and see your antral follicular count. Basically, we see how many eggs do you have in your ovaries. And you do a AMH level, which is an anti-Mullerian hormone test. And these two tests somewhere tell us how much is your egg count and where is your fertility age. Let's just put it that way. So everybody is going to be different. Sometimes at 30 you'll see only 2 eggs and then you need to hurry up if you want to have babies. Sometimes at 30 you'll see 15, 20 eggs, just like a beautiful, a teenage ovary. So it's very subjective. And between 30 and 35, if you're still not sure, and maybe you have a thing that after 35 I might want to conceive, then I think ovarian cryopreservation, or what we call it as egg freezing or embryo freezing, if you already have a partner you want to have a child with, is a wise thing to do, because then you at least have it at the back of your mind. We'll try naturally. It doesn't happen, we at least have a bank. We put
Right.
money in a bank, no Barka. We put our
Yeah.
mega FDs. Why are we
Yeah.
doing it? For a rainy day. So it's
Yes.
just like that, if you have the finances, if you are still unsure, you're crossing 35. Because what happens now, Barka, at 38, 39, you decide you want to have a baby. At
Yeah.
that time, your egg quality has become so poor. Then you
Right.
start the whole struggle. You're 40, 41. Then you end up conceiving. Also, it's a very high risk pregnancy. You have 500 things to do. So, if
Right.
all I say is, if you have the education, if you have the finances, if your partner is supportive, you are supportive. Till 35, you haven't decided. At least you do is you go and freeze your eggs. Egg
Right.
batch of eggs are frozen. You are relaxed. That's it. But
Right.
don't force yourself in pregnancy till you're not ready. Yeah.
Right.
It's, it is so much more than just delivering that baby. The
Yeah.
real struggle starts after that.
After the pregnancy, like, is still like a
Pregnancy
good
is
phase.
bliss. Yeah,
The
yeah,
first year after delivery is what they call the fourth trimester, right? I mean, that's when
absolutely. And that
you
is the most difficult. I mean, postpartum blues are absolutely real. They are the most
right,
real thing, and they're never addressed. I think
right,
I to always tell everybody where I'm giving these live sessions also and all, ki let's concentrate so much on postpartum, because the baby comes in, mother is nicely forgotten.
yes, yes. Forgotten. Even like a lot of times, mothers are forgotten by the family and like everybody who comes.
And
I want
herself.
to see the baby, but then what
Again,
about the
herself. The problem is, Barka, mother feels guilty in taking care of herself.
right?
I've had mothers who've told me, I want to cut my hair. I said, oh yeah, you're having postpartum hair fall. Maybe that's why.
Yeah.
No, I feel guilty. I take too long to shower. Because that's the amount of guilt and, baggage put on you. That as a good
Yeah.
mother, you have to be there. The baby's crying, you're washing your hair. It's not good. It's berserk, the
Yeah.
amount of. So I think we have to all consider that also. And then I repeatedly say it, Barka, till the time mentally as a partner, of course, and also financially in today's day and time.
Right.
It's very important to be financially secure, whatever your security is. I'm not saying you have to reach a certain
Yes.
level, but be sure that where you have a child, you are comfortable to bring that child.
Right. And another question a lot of second time moms have is if they delivered, they had a natural delivery during the first time, is it sure that, they say that it becomes just easier the second time?
देखो, now
So,
these
is
are
it
again,
so?
it's flip side of a coin. Yes, having said that, एक बार normal delivery हुआ है, easy क्यों हम बोलते हैं? Because the pelvis has expanded a little bit, the mother has gone through the pains and everything's happened normally, so there are high chances that it will be a normal delivery. Now what changes is, in most cases, the second born child is always slightly heavier than the first one. Okay, that is just, we always, it's a proven fact. Also, as the mother ages, say you had one normal delivery 7 years back, now
Hmm.
7 years later you've conceived, there's certain amount of how do you say, fibrosis that happens in the pelvis, because of which, though your pelvis was fine 7 years back, maybe it's constricted a little bit now. So now you have a bigger baby and a smaller pelvis. Okay, so these are anatomical things that I've spoken about. Other
Right.
things which vary from pregnancy to pregnancy is fetal distress. That, for whatever reason, the baby stopped getting enough oxygen. The
Right.
baby passed meconium.
Right.
The mother could not take it this time. Suddenly, her BP shot up.
Right.
So definitely trial of labor is something we always give in second time. Unless and until in 34 weeks, amniotic fluid fully reduces. You know what it's called as oligohydramnios or anhydramnios, or there are Doppler changes. In that case, even in second time, we'll go in for elective section. If none of this is true, patient has gone into labor, all of us will always give trial of labor. We are all sitting here to do normal vaginal births. But there is no guarantee that pakka se ye hoga. हमको guarantee, what is in our mind, we don't care. At least for me, Marka, I don't care
Yeah.
about the form of birth. Mother and child should be fine, is what I feel.
Right. Right. That's the end result everybody should be.
Exactly, exactly.
So I will read out a few questions from our readers.
Right.
Uh, Bhavna Antkat has a question. Pregnancy के थर्ड ट्राइमेस्टर में एक्सरसाइज कर सकते हैं?
हाँ, अगर आपके डॉक्टर ने कुछ रिस्क फैक्टर नहीं बोला है कि आपका प्लेसेंटा प्रीविया नहीं है या फिर कुछ इस टाइप का और नहीं है, प्री टर्म लेबर के कोई चांसेस हैं समथिंग, तो आप कर सकते
They also say like doing squats or and sitting on the ball exercises will help you like
हैं. See, technically speaking, what are they trying to do? They are trying to expand your pelvis and trying to make your pelvic muscles stronger.
right.
So I don't know. I haven't read much papers about what is the percentage of who did squats and who did not. So there are no Cochrane reviews that I've really gone through. But I'm sure that fitness experts who endorse it have enough data to support it. So if it's a low risk pregnancy, go ahead, do it. It'll just help you even the process.
Durga Salvi has a question. फर्स्ट ट्राइमेस्टर में किस तरह का रूटीन फॉलो करना चाहिए?
तो देखो, अगेन प्रेगनेंसी टू प्रेगनेंसी हर चीज डिफर करती है, बट नॉर्मली लाइक आई ऑलवेज से फर्स्ट ट्राइमेस्टर इज अ time when you are very high in your nausea and you're sensitive to too many smells, sounds, food. So don't try to bring any changes. Wake up at the time you're used to, sleep at the time you're used to. When you wake up, don't try to bulk your system with a lot of liquids. What we feel is, oh, I'm feeling nauseous, I'll have one glass of water, I'll feel better. That doesn't happen. In
Right.
fact, this nausea worsens with liquids. So instead, when you wake up, you see what reduces your nausea. I always suggest a dry toast. Thoda sa butter laga ke have a toast. That normally sort of reduces the acidity and settles all the bile juices that are waiting to come out. And
Right.
after half an hour, 1 hour, you have your normal breakfast, chai, coffee, jitna stipulated amount has been allowed. Carry on with your normal system. Be very aware of if you have any bleeding, spotting. Don't try to, like I said, do any major weightlifting during the first trimester. And consult your doctor whether having sex in the first trimester is safe for your particular pregnancy or not. And then
Right.
rest of it is all fine. Yeah, I always say pregnancy is not a pathological condition; it's a physiological condition. Meaning,
Right.
वो natural चीज है. तो तुम उसको इतना don't make it into a condition. It's something very normal. Just go with the flow.
Yeah, a lot of times, people say that pregnancy is not a disease. Like, you are
Exactly.
not restricted to be not doing this, not doing that, but rather like you enjoy that phase. You're
Or
not
tell
sick.
it like how these old दादीज and नानीज का, हमारे हमारे टाइम पे तो हमें पता ही नहीं चला था 6 महीने तक हम प्रेग्नेंट हैं.
Yeah.
तो चलो वो थोड़ा एक्सट्रीम हो गया, because I mean we don't want to miss out on the scans that we do and all of that. But still, having said that, pregnancy has to be taken little with a pinch of salt. Take it seriously when it has to be. keep enjoying your life. I mean, don't. There are times when we get so psyched out, we're actually counting the number of breaths also that we are taking. So,
Yeah.
itna psych out nahi hona.
The Sneha Kumari has a question. Twins baby रहने पर exercise possible है क्या?
So see, twin pregnancy is automatically bounces to a high risk pregnancy. Okay, we live twin
By
pregnancy
default.
kaise hota hai? Yeah. So and in twin pregnancy there are high risk where there might be a thyroid problem, there might be sugar, there might be blood pressure, risks of preterm labor, etc. So where we always recommend 30 minutes of exercising at least 5 days in a week in all pregnancies. In twin pregnancy, we will categorically stratify and tell you what form of exercise is fine for you. Sometimes, if it's a high risk pregnancy where preterm labor is suspected, maybe we'll just tell you 30 minutes of normal pace walking.
Right.
Just after your meals, just walk a little. That is
Right.
also enough because we don't want you to get blood sugar or blood pressure just lying down in bed also.
Right.
So कर सकते हैं, ऐसा नहीं है किस टाइप की एक्सरसाइज और कितनी क्वांटिटी वो आपका डॉक्टर आपको बेस्ट बताएगा.
Right. And we have a question from Madhvi. Hello, doctor. Which type of food should be avoided during first trimester?
So see, technically speaking, there's no data to avoid anything. Now, what we are living in a country which has a lot of superstitions. All I
Papaya.
tell you is, if your family is telling you not to eat papaya and pineapple, don't. They are not such delicious fruits that you can't live for 3 months without.
Yeah.
This is then the rebel in you that is waking up and saying, no, I want to just prove them wrong. So I'm not saying I have any data to support this, but your mother is going to be at peace, your grandmother is going to be at peace, and you are going to be at peace. So just avoid that papaya and pineapple.
Yeah.
There are a lot of people who don't want you to eat eggs in first trimester, and then fruits and nuts in first trimester. As long as your hemoglobin is fine, you're eating and not starving. दो तीन चीजें डाइट से हटा भी दी, 3 महीने के लिए तुम्हारा मोस्ट फेवरेट फूड भी हटा दिया है. Somebody who absolutely relishes papaya, you can live without it for 3 months. Yeah, so just avoid it and keep yourself in peace now.
Right. Another question that we have, can I travel in second trimester if health is fine?
So see, I think this I've already covered. Traveling is not a restriction per se in a low risk pregnancy. So you
Right.
have to ask your doctor. She or they give you a green signal. Go ahead.
So it's safe to travel if everything is all right.
Yeah, yeah.
Yes. So I think we've all answered most of the questions and we've covered our topic beautifully. So I would like to say a big thank you, Tanushree, for doing this live with us and live with Baby Chakra community. Thank you so much. This was so insightful, and our pregnant moms have definitely, got a few talking points that they can go and talk to their gynacs about.
Thank you so much for having me over, Barka. And it's always a pleasure talking with you, associating with the Baby Chakra group, and just discussing very pertinent topics. So,
Right.
had a lovely session. Thank you.
Same here. Thanks, Tanushree.
All right. See you. Bye bye.
Bye.